cheese is not enough to prevent falls and fractures. Hello, I'm Baram Jam, and thank you for joining me for this short presentation. It's almost unbelievable that 55% of postmenopausal women are osteopenic, and that an additional 30% are considered osteoporotic. Therefore, up to 85% of postmenopausal women show signs of bone density loss. As the population ages, osteoporotic fractures are becoming an increasingly significant cause of morbidity and mortality. Within 1 year of experiencing a hip fracture, 50% are left with permanent disability and 25% will pass away. Osteopenia shouldn't be ignored as it does increase the risk of developing osteoporosis. There are now hundreds of published clinical studies on how to best prevent or reverse osteopenia in order to reduce the risk of fractures. To minimize the risk of osteopenia progressing into osteoporosis, the following recommendations are typically made. Calcium and vitamin D supplementation, which we'll talk about, dairy consumption, quitting smoking, reducing caffeine and alcohol consumption, sun exposure, and finally, physical activity. Despite the hundreds of studies, there continues to be quite a debate on the efficacy of taking calcium supplements and vitamin D as preventive measures. Let's look at 5 review studies and their conclusions on vitamins and supplements. Study number 1 was published in British Medical Journal back in 2015. It's a review. We'll just read the highlighted conclusions. Dietary calcium intake is not associated with risk of fracture, and there's no clinical trial evidence that increasing calcium intake from dietary sources prevents fractures. Evidence that calcium supplements prevent fractures is weak and inconsistent. Let's go to study number 2, published in Journal of American Medical Association. It's a review paper in 2017. Let's just jump into the yellow highlighted conclusion. In this meta-analysis of randomized clinical trials, the use of supplements that included calcium, vitamin D, or both compared with placebo or no treatment was not associated with a lower risk of fractures among community-dwelling older adults. These findings do not support the routine use of these supplements in community-dwelling older adults. Let's go to study number 3, published again in Journal of American Medical Association in 2018. It's a practice guideline study, which concludes that the United States Preventive Services Task Force recommends against daily supplementation with 400 IUs or less vitamin D and 1,000 milligrams or less of calcium for the primary prevention of fractures in community-dwelling postmenopausal women. These recommendations do not apply to persons with a history of osteoporotic fractures, increased risk for falls, or a diagnosis of osteoporosis or vitamin D deficiency. So again, we're going to go to study number 4, published in the British Medical Journal. It's a meta-analysis. We'll jump to the highlighted yellow conclusions. The use of supplements that included calcium, vitamin D, or both was not found to be better than placebo or no treatment in terms of risk factors among community-dwelling older adults. It means the routine use of these supplements in community-dwelling older people should be treated more carefully. And finally, study number 5, published in the European Clinical Journal of Nutrition in 2022. It's a review paper. We'll jump to the conclusion. It says no study in women in which the mean age was greater than 60 years reported a positive association between calcium intake and change in bone mineral density. We conclude that calcium intake across ranges consumed in these studies is not an important determinant of bone loss, particularly among women older than 60 years. So, for some reason, there's still healthcare providers and various osteoporosis associations that strongly promote calcium supplementation for preventive measures, despite the obvious lack of evidence. In those with osteopenia, fractures occur as a result of falls. And to my knowledge, there's no vitamin supplement, glass of milk, cheese, or yogurt that prevents falls. Perhaps instead of obsessing so much over supplements and calcium intake, the primary focus could be on promoting physical activity, where there's no question that it benefits bone health and is preventative of falls. Look at this review, Osteoporosis International study published in 2022. Effects of non-supervised exercise interventions on bone mineral density in adult women, a systematic review and meta-analysis. And they conclude with non-supervised exercise improves femoral neck and lumbar spine bone mineral density in adult women. I'm just sharing with you one of the more recent systematic reviews. To minimize the risk of falls and fractures, I personally propose that the single best intervention healthcare providers can offer is to simply make people feel more confident in themselves. We can begin by not labeling osteopenia as a disease that's present in half of all postmenopausal women. The moment this negative diagnosis is given, some lose confidence in their own body and sense their natural aging to be a disease. After being diagnosed with this disease called osteopenia, some sense that they have gotten old. They lose hope and inevitably act and move as an old person would. From my own personal clinical experience, the primary factor that limits physical activity and walking speeds in many of my senior patients is fear. Look at this review from a Cochrane database back in 2014. Exercise for reducing fear of falling in older people living in the community. Fear of falling is common in older people and associated with serious physical and psychosocial consequences. Exercise, planned, structural, repetitive, physical activity aimed at improving physical fitness may reduce fear of falling by improving strength, gait, balance, and mood, and reducing the occurrence of falls. The primary intervention for slowing the progression of bone density loss must be to increase an individual's confidence in their own body, exposure to a variety of movements, and confidence in optimally loading their body. I'm all for quitting smoking, having a nutritious diet, reducing alcohol and caffeine consumption, and optimal sun exposure. These factors are very relevant to bone health. However, if a person lacks confidence in their own body, fears of experiencing pain, injuring self, or having a fall, then all other interventions for improving bone density health become, frankly, meaningless. This is my 94-year-old grandma, squatting without fear. Look at her, she's even smiling. This picture is 2 years after she had a fall resulting in a non-surgically treated hip fracture. I've learned tremendously from my grandma. If you wish to learn about risk of fall evaluation and practical movements that help reduce fear and increase confidence in seniors, please look at the free preview section of my online hip OA course offered on Embodia Academy. You can also access the link to the online course on APTEI.ca. Thank you for your time, and I hope that you find these few minutes talking about osteopenia and bone density valuable. I look forward to seeing you again.